High patient numbers at Mosaic. Leaders there also sounding the alarms, and they're making warnings to the public, even as they're expecting even more patients to come through their doors. Here's KQ2's Jody O'Brien.
We're seeing an unprecedented number at our hospital.
COVID beds at Mosaic Life Care are filling fast. Just this week, the Mosaic system hit a record number of people hospitalized with COVID-19. 95 in their hospitals in St. Joseph, Maryville, and Albany. The majority taking up beds in St. Joe, Mosaic's largest hospital.
What we are seeing around us, not only in Buchanan County, but in the surrounding counties, are increasing numbers of positivity. Once people end up in the hospital with COVID, they are here for a long period of time, especially if they end up in our ICU.
While the hospital is bracing for a continued influx of patients,
even though our numbers are high, and I expect our numbers to continue to remain at this level for several weeks to come, if not the next couple of months.
Healthcare workers are being stretched to their limit.
The stresses that the nurses feel in these cases are very different than what they face during their regular course of work during the year. These are some very sick patients. With COVID, they don't have many family members that can even visit. So sometimes it's our caregivers who are having to hold their hand and be their family members, or at least be there for them until their family members can be there. So it's a lot of strain on our caregivers, and we're very proud of how they're handling it. But it is a stress.
Like healthcare professionals across the country concerned about staffing as the coronavirus surge grows, Mosaic has contracted with outside nursing agencies to help take off some of the pressure.
Right now, they are doing a wonderful job and they're hanging in there. But again, you know, over the next few months, I don't know how things will all work out with them from just a standpoint of the stress, especially if the numbers go up.
Mosaic is urging you to continue to wear a mask, social distance, and wash your hands. Fearful the next few months could put many at risk and tax an already stressed out hospital system.
The next few months bring concerns. The combination of COVID, the flu season, students returning from college, cold weather driving folks indoors, and holiday gatherings have the potential for big spikes.
So far, Mosaic has been able to handle the surge in COVID cases, but what happens if cases continue to rapidly rise?
I've been asked many times, what's the number when you would be overwhelmed? I don't know what that number is yet. It really comes down to having the capacity of caregivers to provide that care.
Not yet at a breaking point, but record-breaking numbers don't lie, leaving a community facing a hard truth.
You know, this next few months with flu and all these other factors, it's very critical. But hopefully our community's listening and will continue to listen.
That was KQ2's Jody O'Brien. COVID patients, of course, not the only ones filling the beds at the hospital. Mosaic saying their doctors and nurses care for about 200 other patients at the hospital.